COVID-19 for over 15 months continues to impact us globally, affecting lives and livelihoods. Vaccines play a critical role in providing that added level of protection, preventing deaths and hospitalization from the severe form of infectious diseases. According to the World Health Organization, emerging data on effectiveness indicates that COVID-19 vaccines are contributing to the control of the spread of the disease. As of Tuesday, June 29, 2021, St. Lucia records the administration of 30,815 first doses and 21,956 second doses of the AstraZeneca COVID-19 vaccine. The highest uptake of the vaccine is noted amongst the over 50 years age group, followed by those 25 to 49 years, and then those 18 to 24 years. Typically, young adults are less clinically affected by COVID-19 infection, and as such, they may see limited value in getting vaccinated. According to data from the Ministry of Health and Wellness, the highest number of cases have been noted in the under 50 years age group. In light of this, the Ministry of Health and Wellness will remain steadfast in its efforts to educate and communicate the importance of vaccines to enable people in making the choice to get vaccinated. Failure to vaccinate widely enables continued circulation of the virus and the generation of variants. As economies slowly reopen and restrictions are lowered, the risk for importation of COVID-19 cases and variants become high. Therefore, the need to be vaccinated becomes increasingly important. Further, widespread vaccination contributes to fewer people being ill and having to be hospitalized, thus reducing the COVID-19 burden on the healthcare system. In addition, it will allow for the return of normal social functioning and reopening of the economy. Reports of adverse events continue to generate a level of concern and hesitancy towards the vaccine, and in some people, getting vaccinated. For others, the need to delay vaccination while they wait and watch, or even strongly oppose being vaccinated. The Ministry of Health and Wellness remains committed to ensuring that its monitoring system is robust and that processes are in place to address any untoward event that may occur relating to vaccines. The safety of our population is priority. Hence the reason why only vaccines that are pre-qualified for use by the World Health Organization will be offered to the citizenry. The Ministry of Health and Wellness is responding to the call for options of the COVID-19 vaccines. Progress is being made towards the procurement of other COVID-19 vaccines to be included in the routine program. Over the past weeks, there has been discussions surrounding the expiring of batches of vaccines. Like any other drug or product, vaccines have an expiration date. That is, the last day on which a product can be used. Vaccines cost a lot and are also in limited supply, especially at this stage of this pandemic. COVID-19 vaccines also have a short shelf life, in most cases approximately 6 months. In light of this, the Ministry of Health and Wellness ensures that vaccines logistics are planned carefully to avoid or reduce wastage of vaccines, and as such, do not have any doses of the expiring batch of vaccines at its central stores. The Ministry of Health and Wellness continues to appeal to the public to access the COVID-19 vaccination clinics across the island. Until widespread vaccination has been achieved, both vaccinated and unvaccinated people need to be aware that the additional protective behaviors of wearing masks, hand hygiene, and physical distancing are required to control the pandemic. The Ministry of Health and Wellness will provide further updates on St. Lucia's COVID-19 vaccine implementation.